Welcome to episode 25 of the Cancer Pod. In this episode, we're talking about diarrhea, loose stools, and ways to address them. I'm Dr. Tina Kaiser, and as Leah likes to say, I'm the sciencey one.
And I'm Dr. Leah Sherman, and I'm the Cancer Insider.
And we're two naturopathic doctors who practice integrative cancer care.
But we're not your doctors.
This is for education, entertainment, and informational purposes only.
Do not apply any of this information without first speaking to your doctor.
The views and opinions expressed on this podcast by the hosts and their guests are solely their own.
Welcome to the Cancer Pod. Hey, Tina.
Hi, Leah.
So I'm wondering if we should do like a content warning for this episode. I don't know if people would be kind of sensitive about talking about diarrhea.
Yeah, I think we're desensitized as naturopaths.
Yeah, because we talk about poop all the time. And we didn't do a content warning for constipation. But yeah, if you're like kind of grossed out from talking about bodily functions, this might be an episode that you skip.
Or we will be gentle. We're not going to be graphic.
No, but we're just talking about it. It's like with the vomiting episode, just by saying the word, sometimes that triggers people.
Mm-hmm.
So this is your trigger warning.
All right.
That's it. So this is the third episode in our Side Eff pod. And the first one, we covered kind of the basics on why bowel changes happen. And then our second one was about constipation. And now we're talking about diarrhea.
The flip side.
The flip side. Yeah. So what is it? What do you do about it integratively? What do you do about it, from the pharmaceutical or over-the-counter standpoint? And then we end this episode with not only our song, but our moment of woo.
Great. Yeah, and we'll go through diarrhea and loose stool. We should just say loose stool, because really, that's when you start to treat it, don't you think? I mean, you don't wait for overt diarrhea if you can help it.
Right. But people define it differently. So diarrhea is defined as being loose or watery stools 3 or more times a day. So back in the first episode, when you talk about kind of that milkshake consistency that happens as the stool moves into the large intestine, basically, if the water isn't being absorbed out of that and it continues to pass, then there you go. That's your diarrhea. So yeah, loose or watery stools.
Yes.
With frequency.
Yes. So that is the definition of diarrhea.
That was it. See, I just fit that in.
I just slipped it in there. Well, and I want to just say acute diarrhea is considered less than 2 weeks of diarrhea, and chronic diarrhea is 2 weeks or more if it's lasting longer than 2 weeks.
Right. And, there are patients who will enter treatment with this being a chronic condition, like it's just something that they've managed and lived with. It's the same with constipation. That's kind of your baseline. And so that's really when we want to be really proactive, because the treatments aren't going to, sometimes they'll shift you the other way, but you want to stay on top of it, because again, diarrhea is one of those side effects that treatment can be held, doses can be reduced because of the consequences of the symptom.
One of the largest consequences, besides actual pain on defecation, which can happen with diarrhea, is the electrolyte issue, right?
Right.
Losing your electrolytes more quickly than you're replacing them would be one of the big consequences, which can lead to spasms and weakness. Low sodium can present as weak legs, for example. It's classic.
Yeah. So people become dehydrated because all that fluid is just coming out. And so staying on top of hydration, not only, with water, but we'll go into more of other ways of replenishing what gets lost.
Let's take a break and come back with some details on what people can do about it.
Perfect.
Did you know that your stool is mostly composed of water? After that, most of the solid part of your stool is actually bacteria, what you often hear referred to as the microbiota of your gut.
So in our first episode, we kind of touched on why bowel changes happen, and it was just kind of a general overview, but I guess we can quickly review some causes of diarrhea during treatment.
Yeah. Yeah, the most obvious cause is the treatment itself.
Rapidly dividing cells.
Right. Some treatments will list diarrhea as a side effect of that treatment. And some of them are chemotherapies. If you're getting any radiation to the gut in particular, that can cause diarrhea.
Oh, if you get radiation to your spine in a location that is on the other side of your gut, I think that's something also people don't really expect. Or if for prostate cancer patients, the gyne cancers too, cervical cancer, that's a big side effect.
Mm-hmm. Yeah. So if there's radiation hitting anywhere along the GI tract, whether intentionally or due to the radiation field, including the GI tract, whether it's the pelvis or the abdomen, and then surgery, short bowel syndrome could be an issue, or just a portion of the GI tract has been removed due to the cancer.
Right. Like just even for people who have had gallbladder surgery.
Mm-hmm.
Or anything that would affect the pancreas where you would not have enzymes that help to process your food. And then the targeted therapies was a big one, as well as the colitis that could happen with immunotherapy.
Right. And then lastly is some cancers. They're not common, but there are some cancers that present with diarrhea.
Right. The carcinoid. Yeah.
Yeah.
And then I guess ultimately, the changes to the microbiome, right?
Yeah. It's always going to be a consequence. The microbiome will change during treatment.
Right. And that would also be like infection. So something like C. diff, that's present in a lot of people. And then with treatment, it gets out of balance. And then it becomes a really, difficult to treat and important to treat issue. So,
yes. So first off, try to pursue the cause of the diarrhea so that you can treat the cause if that is possible, or at least know how to manage it with keeping the cause in mind. And then afterwards, there can be abnormalities in your endocrine function, there are autoimmune reactions that have been triggered. There's all sorts of reasons.
So when you're saying endocrine, you're talking about like thyroid issues.
Mm-hmm.
Yeah.
Yeah. So
I'm bringing it back down to the people talk.
Yeah. Yes. So follow up with primary care physician. It's important to keep a primary care physician as part of your care team so that when treatment is over, if you have lingering symptoms, that's the most appropriate person to address lingering symptoms after treatment, whether it's diarrhea or anything else.
Right.
Not your oncologist. Even
though we all do go back to our oncologist and talk to them about those things, because we probably see them more often than we do our primary care.
This is true. But studies suggest that bringing in and keeping a primary care physician, you get better outcomes.
I'm just thinking like you see your oncologist like every 3 months or so. And then,
right.
It's a lot of doctors.
I know.
I'm just here to keep it real.
Mm-hmm.
Okay. So, what to do integratively? What are the things that we think of with a patient who has diarrhea? So we've ruled out infection because that would be like C. diff. And then for that, they're getting antibiotics.
Mm-hmm. So yeah, after managing the hydration aspect and making sure that lots of fluids are going in, and sometimes intravenous fluids are required, the diarrhea is severe. Avoiding anything that's going to trigger it is probably the most obvious thing to do first. So lay low on dried fruits in general, fruit juices, caffeine, things that are stimulating to the bowels.
Dairy.
Even if you tolerated it before treatment. So sometimes people during treatment can have that damage to the upper GI area that normally helps you break down lactose in the dairy. If you don't break that lactose down with your lactase enzymes, then that will lead to loose stools. And that can be transient. It will heal eventually, but dairy is a big trigger because of that damage. Yeah.
Yeah. The brat diet is a really popular thing that people will hear of. Probably heard of it even before going through treatment, but that's bananas, white rice, applesauce, and toast, like burnt toast, kind of really toasty toast.
Mm-hmm.
And that is kind of like the staple, the brat diet. Don't use brown rice. That has too much fiber. You got to use the white rice. And that can help to slow down the bowels as well.
Mm-hmm.
And you touched on the hydration. I commonly recommend, because everyone kind of reaches for Gatorade, and I don't know really if Gatorade has the right balance of electrolytes, but it's popular and it's out there. I tend to steer patients towards Pedialyte. I prefer them to do the flavorless, but if they want the flavored, if that's what they tolerate better, that's fine.
Mm-hmm.
I also really like the fact that Pedialyte has the Pedialyte Pops, which are like in these little plastic sleeves. They look like those Otter Pops that you used to get when you were a kid, and they're brightly colored. And sometimes that's just easier to tolerate.
Yeah.
Because of it does have strong artificial flavor, but it's frozen and it's a little comforting. It's easier on patients.
Yeah, that's a good point. And then I often steer people towards the oral rehydration salts as well, which is the official kind of World Health Organization packet formula that has a significant amount of sodium, potassium, and it does have glucose because it's important. It's not just important, it's essential to have some glucose alongside the sodium because the way we absorb sodium in our small intestine is that it's transported into the cells and into our system right alongside glucose. So it's called a sodium glucose co-transporter. And without the glucose, this is why you can't drink seawater. Seawater would give you diarrhea because that sodium will come out the other end because there's no glucose alongside it. Not to mention it's a huge dose of sodium. But in any case, you need the glucose. And I say that because I feel like there's a lot of, in the natural food stores, electrolyte formulas that do not put glucose in because they don't want sugar on their label. And if they don't put that in, then the sodium's not going to get absorbed. So it's not going to be as valuable as the Pedialyte, for example.
Right. And you'll see, it'll say dextrose on the Pedialyte label, I believe. But yeah, and that always made me wonder about those kind of electrolyte drinks, the ones that don't have sugar at all. They have artificial sugars in them for people who have issues with their blood sugar. I'm just wondering how those work. I mean, are they working entirely? So it's just something to think about.
No, they don't.
Well, there you go. They don't work. Okay.
No, they don't work.
You're just drinking gross, salty blue drink.
Yeah.
So do be mindful, especially if you do have blood sugar issues, that you will need some glucose to really process that. I mean, you can still replenish with the other electrolytes, but it just might not be as effective.
Yeah, and you can always remember to salt your foods and either use no salt, which is a potassium. No salt is potassium instead of sodium. It's the stuff that they sell in the stores or grocery stores when people don't want to be doing a lot of sodium in their diet. That's a possibility. And then there's foods that are high in potassium, like avocados are a classic example.
White potatoes. I know people always think about bananas, but white potatoes, avocados.
Most legumes.
I don't know if you really want to eat legumes, though, if you're having diarrhea, just because of all that fiber.
That's true.
Which brings us to fiber. We talked about fiber in the first episode. You want to look at soluble fibers because that kind of slows things down.
Mm-hmm.
Soluble slows. And so oats, I think of oatmeal as like a good soluble fiber.
Yeah, and this goes back to knowing why you have loose stools or diarrhea. Because if it is due to irritation of your colon, if there's a level of colitis, or even if there's been a removal of part of the colon, either way, the insoluble fibers are not going to be well tolerated. So metamucils,
psyllium,
and just insoluble fibers from foods. So the peels of things, the part that's not soluble, the fiber sources that are irritating to the lining will definitely be contraindicated in anyone with any kind of irritation of their GI tract, in particular their colon, if they have diarrhea.
That's what, yeah. So the inside of the apple. So the applesauce without the skins. Like if you have a friend who brings you over homemade applesauce with skins, that would not be helpful. Probiotics are the big thing that people think of. And, I think that there are good brands of probiotics. It's just so hard to say like which ones specifically because of the different strains. Mm-hmm. And Saccharomyces boulardii is a really popular one that I've seen used for antibiotic-induced diarrhea. Mm-hmm. And it can be really helpful. But if you're going through active treatment, I do caution patients because there are risks with it. Patients who are older, if they are receiving enteral nutrition, if they are immunosuppressed, they have neutropenia, or if there's any sort of inflammation of the GI tract, like whether it's from surgery or from the cancer. There have been cases of people who have sepsis after taking Saccharomyces boulardii. So it's just a caution.
So when you say, I'm sorry, I just want to clarify, when you say sepsis, you mean the Saccharomyces boulardii makes it into their bloodstream?
Yeah, it's fungemia, I think it's called.
Because Saccharomyces boulardii is a fungus, technically.
Yeah, it's a yeast. Yeah.
Mm-hmm.
It's related to Saccharomyces cerevisiae, which it makes beer, ferments beer. So yeah, so it can leak into the bloodstream and it can cause people to be really sick. We had a hospitalist where I worked last, and he had seen several cases of that. So yeah, it's just something to keep in mind.
Yeah. Well, and that's interesting because that translocation of any organism, whether it's lactobacilli, Saccharomyces, any organism, other types of yeast that can translocate, and that means goes from either the mouth or the GI tract, somewhere where it's contained in the GI tract, into the bloodstream, which causes a sepsis. Sepsis is basically infection in your blood. That is usually due to a combination of immune suppression and the ability to translocate, meaning there's some kind of either mucositis, stomatitis, like you said, irritation or
Right, inflammation of the GI tract. Yeah, there's little passageways. And so again, that's why if a patient is taking probiotics with their therapy, if they are told that they're neutropenic, they need to stop. If they start to feel feverish and they start to feel the symptoms of having low white blood cells, which would be fever and all of that. So they would stop taking the probiotics as well.
Right. So just so it's clear, these are rare events.
Yeah. But it's something, I mean, neutropenia is not necessarily.
No, not neutropenia. The sepsis is a rare event.
Oh, yeah. No, these infections are not common, but they have happened. And so it's just better to be cautious.
Yeah.
So stopping medications, speaking of stopping supplements, there are certain medications that people take day to day. They came in taking their Miralax and they suddenly have diarrhea from treatment, and they don't think about the thing that they take all the time to manage their bowels. Stopping certain medications, stopping supplements like magnesium, vitamin C, anything that has that effect, the bowel effect.
Oh, that reminds me of a story.
Okay. Tell the story, Tina.
It was during my residency, and I was reviewing supplements with a patient who had unrelenting diarrhea. It was bad. She had seen GI specialists. She was sent to me to help out with it. And I looked through her records, and all I did was take her supplement history, and she was taking a huge amount of magnesium. And my point was, she had seen other people who just didn't do a thorough enough intake and looked at every item that she was putting in her mouth closely enough to have noticed it. Anyone would have noticed it. Any nurse or doctor, pharmacist would have noticed it if they had taken a thorough history and seen how much she was taking. But everyone just kind of wrote off, she's taking a magnesium supplement. They didn't see that she was taking an immense amount of it.
So why was she taking a huge amount?
I don't remember.
Oh, yeah. I mean, I would see magnesium and I would just be like, take it off. Because that is something that you commonly see. Someone's taking magnesium for some other issue. They don't think of it with their bowels. It never affected their bowels before. The treatment changes, and all of a sudden the dam breaks. So,
right.
Yeah, immediately stop any of those things. Anything else that we think about? Did we mention slippery elm? I think we mentioned it in a previous episode. Slippery elm is one of those herbs that can help with either diarrhea or constipation. Just depends on how much you take.
Yeah, so slippery elm, sometimes prebiotics can be helpful, again, depending what the cause is of the diarrhea. So if it is because of the microbiome shifting and just routine, reasons, no actual physical issue like colitis or surgical consequence, then something as simple as prebiotics like larch arabinogalactans, which are a prebiotic that you can get in a powder.
Yeah. And that for some reason, I just thought of sometimes if there's an obstruction, people experience diarrhea. So because it's just that small little passageway, if there's a partial obstruction in their bowels, and so the only thing that gets through is the liquid. So whether the obstruction is from impaction of stool or if it's a tumor, that actually can present itself as diarrhea. So for somebody who's like, oh, I'm so constipated, and now I have diarrhea, that could be why. So I think that's another kind of good consideration to keep in the back of your mind. There's also charcoal that was looked at for one specific chemotherapy with irinotecan. And that's a whole protocol that was something that we would use for patients.
Yeah. Irinotecan is also called CPT-11. So just for the listeners' edification.
So let's see. I think that's probably That's probably it. You mentioned the foods to avoid, the fatty foods, spicy foods, anything that would trigger it. Taking antibiotics, if somebody takes antibiotics for any sort of infection, it could trigger as well.
Yeah, and I want to say when there is almost like an acidity to it when it's exiting, someone can feel some acidic aspect. Sometimes that can be because the food is going through so quickly, your bile acids are fairly acidic. So stool, a normal pH of stool is around 6, give or take. And if it goes through and it comes out and more acidic, you're going to notice that at the exit, and that will be irritating.
So if you have burning poop, if you have burning diarrhea,
I'm trying not to gross people out.
if your poop stings when it comes out,
Yeah.
think that maybe you're having rapid transit.
Yes. And the one thing that can prevent that is petroleum at the exit to protect the tissue until you figure out how to get it, improve the absorption. And that's where the charcoals come in handy and these adsorbents, whether it's whatever the source is that you're going to adsorb with, those soluble fibers.
And, there is caution with those. And, we'll talk about more of the over-the-counter stuff next, but there is caution with those things like charcoal and different fibers in terms of interfering with absorption of oral medications. And so being careful not to take them alongside. And then also, charcoal, I wouldn't recommend. Charcoal's used to absorb poisons. And so it's not something that I would recommend for just regular diarrhea because I don't know. I just feel like there's always potential for it to interfere with something.
Oh, as far as oral agents or other drugs?
Yeah. Like if you're getting diarrhea from taking an oral agent, I wouldn't look at those adsorbents.
Does that bring us to our next segment?
That's the lead in for the next segment. We're going to talk about pharmaceuticals and over-the-counter stuff.
All right. See you on the other side.
Fiber-rich foods have some combination of both soluble and insoluble fibers. If you're trying to slow down your bowels, try oatmeal, barley, and bananas. Soluble fiber foods also are supportive for heart health and help regulate blood sugar.
All right. So, of course, there's plenty of medications that are used for diarrhea as well, both over the counter as well as prescriptive.
Yeah. So these are the things, because you're always mentioning about commercials for pharmaceutical stuff, and I don't ever see those commercials, but these are commercials from my childhood that I remember, right? So let's start with the anti-secretory medications. And so those are bismuth, which is Pepto-Bismol, the classic.
Mm-hmm.
And yeah, my caution with Pepto-Bismol is it can turn your stool black, and it can also turn your tongue black.
Right. It's good to remember.
Which could be freaky. Yeah. So that's a little heads up about that. We also have already kind of touched on the adsorbents, which is the activated charcoal, but there's also kaopectate. So that's another one that kind of sucks up whatever's going on in the gut. And then the anti-motility agents would be like loperamide, which is Imodium, which is another common one that patients will take.
I think I was just going to say, I think that's the most common one that I've seen prescribed here in my area.
Yeah. And the caution with Imodium is it can send you in the other direction depending on how you take it. So taking it as prescribed by either, your doctor or the nurse who recommends it, there is a certain way of taking it, a protocol. So making sure that you follow that so that you're not sending yourself into constipation.
Mm-hmm.
And then, there are the prescriptions, I think of Lomotil, which has atropine in it. And so that is another medication. And I may have mentioned this already. I can't remember. I know I wanted to mention this, but my bit of advice is going into treatment to have Imodium on hand and having, a couple different kinds of laxatives on hand, because you don't know which way it's going to go. And then once it happens, especially with the diarrhea part, you want to make sure that you don't have to get out and go to the drugstore. You already have it as part of your kit, your chemo kit,
Right. So I know I keep coming back to figuring out the source of the diarrhea or loose stool, but it's probably because of my experience with so many people and assuming it was one thing and it turns out to be another. I had a patient many moons ago who had unrelenting diarrhea, but she also had a cancer that caused diarrhea. It was a carcinoid tumor. This can cause the excretion of a lot of bile acid. It was fairly well managed, but not well managed enough to have a normal life. She still had to stay home every morning until 11 or 12 before she could really start her day. So it was pretty consequential. In any case, we managed it as best we could. We managed with a GI doc. We did everything possible. And then we removed dairy one day. Unbeknownst to me this entire time, she was an avid consumer of dairy products. And I said, well, take out the dairy and see what happens. And don't you know, she was actually lactose intolerant the entire time. And this was about 3 years of lactose intolerance that was undiagnosed. And unfortunately, I too didn't repeat. I didn't go back and ask and probe more because I also assumed it was a consequence of her cancer, like everyone else. And so it took us longer than it should have to figure it out.
And there are certain foods when someone has a carcinoid tumor that needs to be avoided, but I don't know if dairy is one of them.
No, it's not.
It's not.
No.
Yeah. Oh, and then that also lends itself to, that has its own specific treatment. Octreotide is used for patients with carcinoid. But yeah, carcinoid could be really tricky because it's a symptom of the cancer and it can be hard to manage. But then, people are more than just cancer, right? They're complex. And so they've got other things going on as well.
Right.
Yeah, that's a tough one. That was a good catch.
Well, this is why I probably am someone who rounds back and says, look at the cause. And even when you think you know the cause, if what you're doing isn't working, given that causation, I kind of have this thing in my head. It's a little ditty that goes, reassess, put your ego to the test.
Yeah, I find that, the first place I'll go, if it's some sort of mysterious onset of diarrhea, I immediately go to, what are they taking? Did they start something new? Even like a change in the diet. You get somebody who suddenly starts like doing green juices with all the fiber in there, and that can definitely move your bowels. And so just really, playing detective, being an investigator, and it might not be the treatment. It could be a number of other things.
Yeah, don't give up. If you're doing something that should work and it doesn't work, you have to round back and say, what else could it possibly be? And just be a little bit dogged and unrelenting. And that can be helpful. And there are times that there is nothing but management, and I think of the post-resection, when a good part of the colon is removed, it's very difficult to control loose stools because there's just not enough time for the body or length of colon to reabsorb the water that's in the stool. So that becomes more of a management issue a lot of the time.
So your story reminds me of a patient that had a mysterious onset of diarrhea. And after going through her medications and her supplements and checking for any change in diet, she was like, you know what? I've been eating a lot more fruit. And she ate like a bag of cherries.
That'll do it.
And that's what did it. And so sometimes it's something where it's like, I changed my diet. I'm like eating all these fiber-filled foods. That can send you. So caution about those cherries.
All right. So does this bring us to our moment of woo?
Yeah, we have a song and we have a moment of woo. So let's start with the moment of woo, which we haven't done in a while. So I feel like I'm a little out of practice, but okay. So for those who are just joining us, moment of woo is something that's more like folklore or traditional medicine. And I try to find some sort of science to back it up. So today's moment of woo is castor oil packs. Castor oil packs are something that we learn how to do in naturopathic school. And you take like a cotton or a linen or a towel and you saturate that with castor oil, which you could find in the drugstore. And they're applied to the abdomen. You can apply it kind of like over the rib cage, like kind of on the right side where the liver is. And then you can apply it over the actual lower abdomen if there's constipation, and then some sort of heat source is put on top, whether it's a low level heating pad or a hot water bottle. And you just kind of sit back and you relax for a short period of time. And it's supposed to help with constipation. You can also rub castor oil on your belly and then get into a hot tub, and it's supposed to have the same effect. Heat isn't apparently needed for it to be effective, but people often like that feeling. I don't necessarily have patients apply it over any area where there's a malignancy. And I think that's just something I learned in school. And so I just run with it. But castor oil itself is derived from a plant, from the castor bean. And it's something that is found in cosmetics, like you'll see it on the ingredient list in lipstick. And then it's also used internally as a laxative. So if you're taking castor oil and you have a sudden onset of diarrhea, stop that. And it's also used to stimulate labor.
Mm-hmm.
Midwives have used that. Kind of a fun fact is it's used in paclitaxel, which is a chemotherapy used for ovarian cancer as well as breast cancer. And it's known as cremophore. Cremophore? I'm not sure how to pronounce it, but it's the delivery system for the drug. And so a lot of drugs are commonly bound to something to carry it to where it needs to be. And in paclitaxel, that is what it's bound to. And that's what causes the allergic reaction that people can have when getting the drug.
Yes.
And in terms of studies, I couldn't find an actual study. I found the abstract on looking at the effect of castor oil packs in an elderly population at these rest homes in Turkey. And they monitored the patients for 7 days prior to doing the castor oil pack, 3 days during, and 4 days after. And about 80% of the study participants had reported constipation for 10 years or longer. And applying castor oil packs didn't have any effect on how many bowel movements or how much they were passing through, but it decreased what was known as the feces consistency score. And so it lessened straining as they were passing their bowel movements. And it also helped with that feeling of incomplete evacuation.
Okay.
So yeah, I don't have access to any of the methods or anything, but that was the only study. Well, there was another study that I found, which was, I think, through the Edgar Cayce Institute. I can't remember what it's called now, but Edgar Cayce he was a faith healer and psychic in the 1920s, and he really popularized the use of castor oil packs. And so they had looked to see if there was any sort of way that the castor oil was actually being absorbed.
Mm-hmm.
And that was the kind of mechanism of action for it helping. And when applied externally, castor oil didn't have the same byproduct that is excreted when taken internally. So through your urine, if you take castor oil internally, there is this epoxy dicarboxylic acid that's excreted. And that was not found when it was done topically. And their thought was, well, maybe because transdermal drugs don't go through first pass liver metabolism as they do when they're orally taken. And so maybe that's why it wasn't excreted in the urine, but they were just trying to figure out, is this being absorbed?
Which is funny because Edgar Cayce was a faith healer, so they shouldn't have had to try to prove it. If it was his people doing it, it's kind of funny that they were looking for evidence when all they needed was faith.
Yeah. And, it was, like I said, I mean, they only had 3 volunteers who were familiar with using castor oil packs. And so I would put study in quotes.
Yeah, I was just going to say that deserves some air quotes, study.
Yeah. And so, a caution with castor oil packs, other than, my caution with using the heat over malignancy, would be, it can be irritating to the skin.
Mm-hmm. The Edgar Cayce brand of castor oil is that Heritage that has that.
Oh, that's what the institute is. The Heritage Institute. That's who did the study.
They still sell that brand of castor oil.
Yeah, I know that label.
Mm-hmm.
Yeah. So Edgar Cayce also had a thing, apparently, like when I was little, I think my sister read a book about him, and he would sleep with his ear on his elbow, like his elbow bent. So in his ear on his elbow to like kind of get information through osmosis. He'd have like a book underneath his pillow. I think that was Edgar Cayce. Anyways, we don't have to include this story, but it doesn't work. I just want to tell you it doesn't work. I tried it. And just a little aside, just for working with any oils, because castor oil is so thick, it's really hard to clean out of fabric. When we learned about it in school, we would advise people to kind of wrap saran wrap around the pack, to try to keep it from getting on clothing or sheets, and put an old t-shirt that you don't care about over the pack. You can use baking soda to take out the oil, just apply that immediately to whatever gets the oil. These are my Martha Stewart tips.
I'm laughing because I'm not sure we convinced anyone to actually do the pack.
I'm just saying. No, I'm just saying it's a goop thing. I'm sure that, Gwyneth Paltrow's talked about it and people are doing it. Who knows? Or maybe she hasn't done it yet and she's going to listen to us and she's going to be like, I'm going to talk about this. People use it because they use it for detoxification. Yeah. And that's not what we're doing here. We're trying to detoxify by having people poop.
Right.
So don't use this if you have diarrhea. This is for constipation.
Right.
Are you ready for the song?
I'm so ready for the song.
Okay. You got to get the duck ready because I can't say the name of it without getting quacked.
Yes. To avoid the explicit rating for the podcast, we
That's right.
don't allow any
No bad words.
profanities. Yes.
Yeah. So the unofficial theme song for this episode is by L7 from the 1992 album Bricks Are Heavy. And the song is List.
All right.
So it doesn't really have to do with poop other than you got a list, you're going to be put on it.
Okay. So it's not about diarrhea, but it is about a list.
Yeah. I mean, when I get mad and I get pissed, I grab my pen and I write out a list. And you know who was on that list? Diarrhea. I just changed the lyrics.
Okay, got it.
So yeah. So that's the song. It's an awesome song.
I don't know.
They were a great band. So that's our song. We've pretty much come to the end of our pod, our side effects pod, our side effects pod for the family crowd. Remember to subscribe wherever you listen to podcasts. Subscribe to our podcast and leave a review. We are getting these awesome comments on Instagram, and leave it where you listen.
Yes.
So that other people can read it and then they want to listen too.
That's right. Tell a friend.
Share it on social media. And we are on social media. We're on Facebook, Twitter, and like I mentioned, we're on the Instagram. So, and on TikTok, but I never do anything on TikTok.
I'm not on most of them.
I know. Well, I am as we are, Tina, we are as the Cancer Pod. We are on the talk, on the TikTok.
We're on the TikTok, huh? So all these crazy things I think in my head I could put a video to and go viral.
Yeah, I think we're going to have to start putting the corgi in videos because I think that's the only way we're going to go viral.
I think the viral videos have to do with the corgi getting along with something it's not supposed to get along with, like a hamster.
And, if you like what you hear, you can also buy us a coffee. So the link should be in our show notes as usual.
Yep.
And it's basically a way to support the podcast if you like us. And it will help us hopefully be able to hire an editor and a producer, maybe someone to run the social media, and just let us focus more on content.
That's right. Want to reach a lot of people. That's the goal.
So yeah, you can buy us a coffee. I like Americano. Decaf, please.
I'm an Americano fan myself. Mm-hmm.
Oh, twinsies.
Mm-hmm.
2 Americanos, please. 16 ounce.
Oh, no. 12 ounce extra room. Sorry.
Oh, man. 16 ounce, no room. Boom. Okay. There you go. That's our order. And on that note, I'm Dr. Leah Sherman.
And I'm Dr. Tina Kaiser.
And this is the Cancer Pod.
Until next time.
Thanks for listening to the Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaiser. Music is by Kevin MacLeod. See you next time.
We don't have to include the story.